We do work as a team in oncology. If a patient has one or more complications, the team addresses those one or more complications using current guidelines based on high quality evidence. Having said that, the research keeps driving toward better understanding of the causes of these complications, trying to decide and predict up front which patients will develop which kinds of complications so that ideally we can prevent them. That's the thrust of research in symptom clusters. Many of the guidelines in which I'm involved are being centered in the organization of MASCC ISOO, the Multinational Association of Supportive Care in Cancer, that works in alliance with the International Society of Oral Oncology. And the guidelines in which I'm specifically involved are a range of complications of the head and neck, including mucosal injury, the mucositis we talked about, pain, taste changes, infections in the mouth, and the like. And we're in the process of conducting very comprehensive, high-quality literature searches that are approaching completion in the middle and end of this year, that in turn will be used to develop new guidelines based on the state of the science. Probably the best example we have right now would be that of the mucositis we had talked about. And if we can find new methods to treat the pain of mucositis, that could help patients on their optimal head and neck regimen, perhaps keep them out of the hospital that we talked about with all the clinical and costs associated with that. Again, we're in the middle of these reviews, so I don't actually know today the final impact on the new guidelines. But having worked in the field of guidelines for many years, I can see that the state of the science will continue to drive new guidelines over time. Well, we've got a portfolio of individual toxicity-based guidelines right now. And we're approaching the systematic reviews and the new guidelines toxicity by toxicity. However, we're going to be building in future research directions into our recommendations, and those future research directions will be directed to the symptom cluster. The best approach is to look at the guidelines with MASCC and ISOO, for example, on oral pain, oral mucositis. We've got recommendations for medications that we prescribe based on the research and that we recommend not necessary based on the research. There are techniques in certain patients receiving high-dose chemotherapy that cause mouth sores where oral ice chips, just having the patient use ice chips 30 minutes before the infusion of, say, 5-fluorouracil, something like that, has been evidence-based and is in our guidelines right now. So it's really a matter of looking at the toxicity, the science behind it, and then going right to the guideline of medication-based, ice chips, preventive approaches in education. That's also very important as well.